My name is Setor Kunutsor and I'm the research officer for COMDIS Uganda. I'm actually responsible for managing the three projects in Uganda here. I oversee the staff. I'm responsible for data collection, for analysis and then write-ups and then dissemination of the project outcomes. I'm also responsible for budgets and this, yeah. HIV AIDS is a serious public health problem in Uganda. It used to be quite very serious a few decades ago, but the prevalence is come down. It's about 5.4% in adults, and currently we have about 336 people who are eligible for antiretroviral therapy, but there are about just 190 who are receiving treatment as of now. And the National AIDS Control Program is gradually scaling up antiretroviral treatment, and about 336 sites have been accredited for antiretroviral therapy. Simply put, it's just medication given to people who have HIV AIDS just to prevent their symptoms from progressing. It's a lifelong treatment. They are actually developing, it's more of operational research whereby they develop interventions for TB and HIV care. Currently we have about 3 projects now in Uganda. We have the ART project, which is more of identifying interventions to improve adherence levels in the people with HIV AIDS. We've identified about 5 interventions which we are trying to implement and then see if it's feasible in resource constrained settings. We have the patient flip charts, we have the adherence calendars, we have mobile phone recall, we have treatment support interventions, and then we have the patient education cards. I'll talk about the mobile phone recall. The mobile phone, we've actually identified, we did an initial survey to identify people with mobile phones and if they would accept to be called to attend clinic if they ever fail to come to the clinic. So we did that at 2 of the sites, and what we do is anytime a patient fails to come for an appointment, we call or send a patient an SMS to remind he or she about his appointment, and then they subsequently come. We rolled that out in October, and so far it's working really well. Patients are called or they are sent SMS, and they do come for their appointments to pick up their medication. The flip charts, it's actually it was adapted from a WHO material. What we have is we have some very simple pictorial diagrams for the patient. It teaches about the basics of antiretroviral therapy, the types of medications, side effects of the medications, and he also teaches the patients about the development of HIV AIDS and that sort of thing. And patients are taught the need to take their antiretroviral medications and why they need to take them. If they, it's a lifelong treatment, they need to take it all the time. And patients are normally educated on that regularly, sometimes 1 weekly or 2 weekly basis, just to keep on reminding them about the need to take their medication. It's a simple booklet. It has a calendar for the various months and then years. I think it's a 10-year booklet whereby patients monitor themselves about their their medication taken. Anytime a patient takes a medication, he or she ticks that he or she is taking the medication morning and evening. And when they miss their medications, they are required to give the reason for missing their medication. And anytime they come to the clinic, they are supposed to bring the booklets along with them. And the adherence worker at the health facility goes through the booklets and then confirms whether the patient has been very compliant with his or her medication. However, if there's a need to educate and counsel the patient further, they do so. It's been working really well. We did some site visits, and the adherence workers have confirmed that patients say it's reminding them to take their medication. It's a strategy or intervention whereby patients are allowed to choose their own buddy, as the name suggests. It could be a friend, a relative, a sibling, somebody you trust, somebody you can put your trust in. The person knows you have HIV AIDS, and person will have to maintain confidentiality. So what the person does is the person reminds you to take your medication morning and evening. The person will remind you to attend to your appointments. The person will help you in terms of side effects, and that's why the person actually helps you in your treatment. That's what, and gives you confidence